I spoke to CDC Director Rochelle Walensky about the timing of the new mask recommendations. Dr. Walensky, what changed in the science that allowed this new recommendation to be made?
So there's both a change in the science and a change in where we are with this pandemic and where we are in getting the country vaccinated. We know from science that less than 10% of cases of COVID-19 have been occurring outdoors. So we have the science to say outdoor transmission is much rarer than indoor transmission. That, with cases now starting to plateau and come down, have really helped us move this guidance forward.
With the risk so low for outdoor transmission, why not remove the mask requirement for even unvaccinated people?
Because we still believe that there is transmission. People are gathering near one another. They're coming less than 6 feet apart, and we know that this virus can trick us. So we want to be very careful for people who are unvaccinated.
You're also encouraging folks, even vaccinated people, to keep the mask on indoors. Do you expect that will change? What science are you waiting for to give you that, allow you to recommend that guidance?
Right. What we're really looking for both is an increase in the number of vaccinated people and a decrease in the number of cases. While we're really encouraged by the ongoing trends right now, I do want to remind Americans that we had a 7-day average of about 54,000 cases this past week. Those numbers are coming down, but that's still higher than our summer surge. As cases continue to come down and people continue to get vaccinated, we're hoping that we can then relinquish and produce more guidance.
It feels like a lot of the excitement around today's announcement has to do with the mask, but I feel like you were also making a point about the shots, the vaccines themselves. Have they proven in real-world experience to be more effective than you imagined?
They're working exactly as they did in the clinical trials. Our hospitalization rates are coming down, our death rates are coming down, and they're really working to prevent infection, even in those rare breakthrough infections that we're seeing, because we anticipated them. We're seeing people with mild disease, with asymptomatic disease, and that's exactly what we were looking for.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.